Okay, this is introducing you to the basics of performing a lung ultrasound. Remembering that if things are infected or a potential infection risk, you do not take your gel into the room. The gel gets put into a tray and the machine gets cleaned before and afterwards with Clinell wipes. In this context, we'll turn on the machine, which has a relatively fast boot up time, and we're going to be using the curved array transducer for the vast majority, if not all, of our scanning. After the machine comes on, which should be relatively presently, we're going to enter our patient demographics, which should be here, and that'll consist of making sure that we do their last name, their first name, their ID, their date of birth, brief indications so you remember why you performed the examination, and then the critical field for you is to fill in referring doctors, which should be your initials or your employee number. We would then choose the transducer. For this case, we would select the curved array transducer with a lung preset. It requires being touched twice. To confirm that we're on a lung preset, we can see it hopefully on the screen here. We can see lung 3 that appears here. If we've got gel in our tub, we will get gel on the surface of the transducer, and we're going to proceed to scanning as an example with Kapil, who would be our patient that we're scanning. I find it's often easy for female patients or even male patients that I'd move a towel across the chest like that. It'll, if they're naked, it maintains their dignity, and it means that the towel's readily available to tidy up gel. With the transducer probe marker towards the head in a longitudinal plane, we're going to scan this side, initially mid-clavicular. We're going to fan a little bit left and right until we see A lines appearing. We're going to label on the machine that this is zone R1, which will be on label. You can see R1. Done. And then we will perform our scan in this zone, seeing where we see A lines so that we know we're hitting the pleura at 90 degrees. We'll record the clip on Save Video Clip. Then we'll proceed to zone 2, changing our label, which is zone 2 as we slide down. We'll slide down, moving a little bit laterally, again on the bare chest wall until we get to zone 2. We'll usually see the inferior margin of the lung, fan a little bit so that we see those A lines appear, and move up a smidgen so that we're definitively at that lung surface right in the middle of our screen. We'll record a loop there. We'll then change the label to zone L2, or L1 I should say. Fan a little bit, get that A lines appearing. We're going to record that loop labeled L1. I'm going to slide inferior and laterally, just seeing the cardiac shadow appear and come up a smidge. We're going to record that as L2. Then we're going to move to zone 4 on the right hand side. So we'll get Kapil to move his arm to his left shoulder, and what that will do is it'll move everything out of the way so that we can scan in zone 4, moving relatively posterior axillary line, fanning so that we see A lines, and we ideally sometimes identify the diaphragm to make sure that we're in the correct position, because sometimes lungs are relatively high, sometimes hyperinflated, they're relatively low to get to the inferior margin of that lung on that right side. I generally don't recommend scanning zone 3 because we rarely see additional pathology, and it's very uncomfortable to have gel in the axilla for the patient. After that, we use our towel to wipe up, and Kapil can relax there. And what I do from this point is I'll rotate the machine around so that I'm scanning the other way around. What I'll get Kapil to do then is lean forward with his arms crossed. This means what I can then do is that, labeling each zone, we can scan zone 5 on the right, zone 6 on the right, zone 5 on the left, zone 6 on the left, and we can also reach across without going in front of the patient to scan zone 4 on the left. Remembering to label each loop as we go. and then our towel should be there to clean and place in the contaminated laundry area. We'll return to the machine and we can compile our report, which will be available on a worksheet, reminding yourself that our worksheet is at the bottom left, showing lung, and we can scroll down giving free text as we do, and then save images to save the complete report. Thanks very much.